Flexible.
I don't need my arms. Oh. Whew. Well, good afternoon, everyone. My name is Dr. Lee Norman. I'm the Secretary of the Kansas Department of Health and Environment. And if you'd be so kind as to introduce yourself.
Stacy.
Stacy. She's kind enough to come in and do sign language interpreting for us today. This is, at least while everything is so busy and going on, we thought that would be a good idea to have you guys meet with me on a, for now, Monday, Wednesday, Friday basis, thinking it'd be a good opportunity for questions and answers and to just update you as to what's going on about the COVID-19, the novel coronavirus we're seeing. It has been a very busy week, as you know. The information became known about another case that we have in the state of Kansas, a 72-year-old man who has returned to Kansas from a cruise in the Western Caribbean, came back to the state of Kansas and was not symptomatic on the trip back, not symptomatic for the first few days, but has become positive, ill, and is in a hospital in Wichita. So again, with the death yesterday of the patient in Wyandotte County, with the exception of that gentleman in a skilled nursing facility, the cases have all been imported from either the northeastern part of the United States, Florida, or in this case from a cruise on a ship. Where the gentleman was in Wyandotte County was the Life Care Center of Kansas City, in Kansas City, Kansas. The reason I bring that up is I think it's important part of notifying the public that if visitors or anybody has had any contact with that Life Care Center of Kansas City, or if other hospitals or caregivers have seen any patients that have traversed there, or anybody that's visited there, or staff members, for example, that information becomes known so that we can track back and make sure that we do our epidemiologic work to do case monitoring, case tracking, that, as we've talked about before. Okay.
Any new cases today? Or?
The one that I just mentioned, Martin, the 72-year-old man, is the new case today.
Are
Yes.
you placing the nursing homes, Kansas, under greater scrutiny than previously?
There's a lot more.
Nursing homes or skilled facilities?
There, to that point, there has been new guidance published by CMS that has been shared with all of the skilled nursing facilities in the state. It has what would be considered to be best practices for how nursing homes manage infection control, essentially. And it has things such as recommendations about cleaning, about restricting visitors, and other protective measures. That was released on the 12th of this month, or excuse me, the 11th of this month. And we've been working closely with KDHE on that. Of course, because this gentleman that passed away was a resident of this particular skilled nursing facility, the Wyandotte County Health Department and medical leadership at the health department, and we are involved in the case tracking, that is the contact tracking of anybody that could have come into contact with that particular person. We don't find the obvious, any particular obvious source of the infection for this person, but he was essentially bed-bound, so it's obvious that the infection came to him.
Are you testing other residents at that nursing home now?
Yes, we're doing broader testing to find out. And I think if you look up in the Pacific Northwest and see what happened there, there was a number of nursing home patients and staff, for that matter, both in that facility and that in the community where it started from that nursing home. We have that same concern, of course, and we're doing all we can do to contain that. And the first step, as you would expect, would be interviewing, finding out if anybody's been ill, finding out if anybody's traveled, and test the people.
You mentioned the Pacific Northwest. Are you aware that Life Care Center is owned by the same
company that owns those, and how does that play into the investigation?
Well, it is noted by us that the ownership of both of those nursing homes is the same. It will focus a lot on if there's been any personnel sharing or any opportunity, or if that's just happens to be the fact that they're a large firm that has a lot of skilled nursing facilities throughout the United
I
States.
asked last
Why
night
is the
whether
delay
this particular
in naming that
nursing home
nursing
was
home?
following the guidance, and I got kind of an answer that you think somebody thought so, but given this company's track record and the 22 deaths at a single nursing home in Washington, what leads you to believe that those best practices were being followed at this facility?
Well, first off, when we talked yesterday about this, had barely even scratched the surface. It was just brand new news within hours, really. So everything that we have, even at this point, we have, because there's a lot of people to interview, a lot of records to look into, like training records, cleaning records, and just to see what are those practices. And again, we're working with KDHE, the Kansas Department of Aging and Disability Services, who has a responsibility for inspections and oversight of nursing facilities. We're working with them because we really are very interested to know what the practices were.
What was the delay in naming that nursing home? Why was there a delay?
The main delay, or I should say, the reason for that was they had a lot of work to do because it was important to recognizing brand new information for them too, that this person had coronavirus. They had a lot of work to do. We wanted to make sure that they could, along with our Wyandotte County folks, could do the epidemiologic work necessary to get in and to immediately limit and do the work to be done to make sure that the staff and other residents were
Will it be the same
protected.
procedure if there's another outbreak in a nursing home?
Oh yeah, it's a rather straightforward detective work.
So
Sir.
talk about testing real quick. Dr. Fauci said yesterday the system's not really geared to what it needs to be right now. Let's admit it. Would you agree with that? Yes or no?
I don't agree with that for the state of Kansas. I think that a lot of places have shortages of test kit materials and can't test everybody they want. Great example is some other states say the only people we'll test are those that are fever, those that have pneumonia and are hospitalized. Those are very stringent criteria. That is not our criteria. Ours are that we don't test well people, because well people will test negative for it. We test, the requirements we have is that the person is ill, that they don't have to have any special travel history, and they don't have to have any special exposure history. So if the patient is evaluated, they're seen by a clinician, we prefer that they have influenza testing done, as well as the viral respiratory panel that tests for many different viruses, because if they have something else, some other illness, we don't need to test them for coronavirus.
How many test kits
But
do
if
we
they
have
come
in
up,
Kansas?
but if they come up negative on those ones I just said, and the physician, hospital, urgent care center wants us to test them, we test them.
So if I walk into a doctor's office right now, I can get tested for coronavirus.
Are you? Well, I won't ask the personal question,
If
but
I've had,
if
I've had cough, fever, those types of things.
yes, if the physician orders it, of course, yeah.
Are there any other residents of this particular facility that are showing symptoms?
None that have been reported to us or have shown up as during the investigation thus far. It's early in the investigation.
And when it comes to screening these facilities, are you just screening family visitors, personnel? What extent is this going on?
And when you say screening, do you mean interviewing to see if they're well, take their temperature, et cetera?
Yeah.
Anybody, all staff, all housekeeping staff, food services staff, visitors, et cetera?
In the states, the state of emergency that exists now, does that give the state any additional power to enforce quote-unquote guidelines at nursing homes? So they're not just guidelines, I mean, you can literally require them to follow these?
Yes, and yes, it does give us additional powers. We already have pretty broad statutory allowances for quarantines, for isolation, and those kinds of things.
Can I ask a question here?
Yes, sir.
The Manhattan schools have shut down. They said they're going to be closed for the rest of this month. Schools are coming back from spring break next Monday. Your recommendation right now?
Yeah, there's a lot of consternation going on about what to do with whether it's K through 12, colleges, universities, we recognize that. We are not recommending at this time widespread closures of schools. We've had no school transmission of illness. With the exception of the gentleman in the nursing home yesterday, we've had no local transmission of disease in the state of Kansas. That said, we think that we will help and are helping schools. We just got off the phone actually with the Commissioner of Education and a group of people with what are the public health principles at play. And the public health principles are the ones we've actually talked a bit about, limiting class size, for example. We think that a class size should be 30 or less in order to have enough distance between for people to have elbow room. We think that the gatherings, whether they're in the community or in the school, they need to have enough room to have what we call social distancing. I think it's highly likely that we'll wind up on recommending that mass gatherings greater than 100 people will likely not be recommended, and we would hope, again, that people will exercise the best public health practices, if you will, and common sense that if it's a non-essential gathering, to not have it, if it's greater than.
Like lunchrooms and such? You know, we're talking
Well,
lunchrooms in schools.
Yeah, we're suggesting that with lunchrooms that the same rules apply, which is 6 feet between people and for 10 minutes or less if you're in that 6 feet bubble, if you will. And that will require some creativity. It's one thing to propagate public health principles. It's another thing to operationalize those. And we recognize that changing lunch schedules, for example, or having bag lunches, grab and go, so that they can spread themselves out and not be on top of each other. We recognize that those things have significant operational effects, especially on the larger schools.
Can I go back to the Wyandotte County victim? We heard that there are some employees at the Providence Medical Center who are self-quarantining.
Yes.
Do you know that to be true?
I don't know all of that. The people are doing the investigation now to find out exactly, because as you can imagine, you have to walk through every step meticulously to find out who might have come in contact. I do know of one caregiver who only had on gloves during the encounter, and that person has already chosen to voluntarily quarantine. And Providence has been very, very helpful in this.
So yes or no, do you know if they've self-quarantined at Providence, or some employees? Have
Yes.
So they have. Do you know how many?
No, I do not know the number.
Testing your epidemiology, I mean, I've heard that this notion of self-quarantining is not a very effective way, particularly if you're quarantined with family members. I mean, what they've done in other countries, China, for instance, is they took people who were under observation and gotten them completely out of their home into a separate facility. Is that the best practice?
Yeah, I think that's see, there's a difference between self-quarantining and mandatory isolation. And it is a fundamental truism that you isolate and put people in respiratory isolation that are sick. If somebody is not sick and they're voluntary quarantined and maintaining social distancing even within their own home or their family members, if they have an environment where they can do that, that's shown to be very effective. But again, it's not the difference between quarantine and isolation. It's the difference between somebody being sick and somebody being well.
Mr. Secretary, can you just quickly explain the policy focus of flattening the curve? I think that's a little confusing to people.
Yeah, statistics tend to be that for people, and it's a statistical nuance in a sense. And think of it as that when there's let's say there's one virus, then there's two viruses, then there's four, then there's 8. It shoots up very quickly, and then at some point in time, every illness peaks out and then drops back down, just like we see with influenza. And what you don't want, and we saw it this year. Matter of fact, we're finally on the downhill slide on the influenza. But go to our website and look at the influenza. What you try to do is say, okay, we don't want the rise to be this steep. We don't want it to go this high. We want to push it down so that it's a slower, graded uptick and doesn't get as high, and then it just dies off and goes away. So then the question is, how do you flatten the curve? And you do that through the things we've been talking about, the public health measures of avoiding crowding, distancing, covering coughs, hand washing, the like, because this one is a problem because we don't have vaccines and we do not have antiviral medications. Those would flatten the curve much more effectively, and especially on the preventive side with the vaccine, it would be set up so that it would never have that kind of peak, because ideally, the flattest of the curve is one that's flat, that never, ever even has an illness. Give an example. If you look at smallpox back in the day, way back when, it had a big peaks and would die down. But after smallpox vaccine, it got so flat, it's gone away. Measles have flattened the curve. It's gone away, essentially, except for an occasional uptick.
You
Back
talked
to the
about
test kits in Kansas, how
narrowing
many
it
do you
down
have?
to groups of 100 people or less. Is that a recommendation? Is that a requirement? Sedgwick County today said it's a requirement if groups no more than 250. Are we looking at the whole state heading that direction?
Yeah, I think we will, ultimately. And the numbers are just, to be honest with you, kind of our best judgment. We're using best practices and recommendations from other areas. In terms of what you're asking me about, is it a recommendation? At this point in time, it's a recommendation that we want to be helpful to the counties and say this is the best judgment that we can give. The counties, the local health departments and the local health officer, in other words, my counterpart on a county-by-county basis, they're the ones that have primary jurisdictional oversight of their county. I and the governor, the adjutant general, we have certain statutory things allowed to us to go in and to do mandatory quarantines, for example. And to be honest, we have mandatory quarantine orders written up should we feel that somebody was not taking the recommendation seriously, was maybe putting patients in harm's way because of not acting as we would recommend. We have the ability to make that happen.
How many test kits do you have in Kansas as of now, and how many have you used so far?
We're using about 15 a day. We've got a couple thousand. So we're hoping that there'll be that the burn rate on the kits will be slow enough that by the time the commercial ones, LabCorp, Quest, and other labs come online, that we will be fine and just ride through it. We have not had a problem with supplies.
When do you expect those tests to come online? When do you expect the private tests to come online?
Well, I was just talking with Congressman Roger Marshall about this on Tuesday or Wednesday.
Okay.
And because he's working it from the D.C. side of things, we thought we would, even in this week or next, have them. There's going to be a logistical problem. I see it, if my information is the most current and most accurate, that they're going to be batched, and one company is going to use a lab in Virginia and one company is going to use a lab in California. That means that there'd be days between time of submission of the lab, the sample, and the running of the test and the getting the results. And I don't like the idea of having to wait days for results.
I was going to press on this for just a second, because compared to some other countries, and Dr. Fauci said this yesterday, I'll come back to that question. He said that we are not prepared. He said that the testing capacity is not like other countries. And to me, it sounds like you are saying that we're okay with Kansas, here in Kansas, testing, but compared to other countries, it doesn't seem like the 2 and 2 are matching up.
Right, I think that's right. Other countries, for example, have other testing kits available to them. They have home test kits in some countries. And it's things that have not gone through the FDA approval process here yet that are available to us. We'd love that. In a infectious emergency, you'd like to have a test lab on every corner so that you could get as quick as the results as possible.
But that's not happening.
Well, it's not happening yet.
Are you getting funding from the CDC? And if so, what is that going
We're getting funding that came through that $8.3 billion federal package, and we don't know, when the money will arrive or exactly how much it'll be, but we're receiving word that it'll be in the $4.5 million range, which will allow us to replenish our strategic stockpile. We want to really push out, because our local health departments are a little bit thin on personnel. We would really like to be able to enrich the county-by-county health departments.
Last question.
After this Wyandotte
Okay.
County death, is this considered a community spread yet?
Well, it doesn't really meet what a purist epidemiologist says is community spread, until you say we don't know who gave the person that. If you have one person that gave one person an illness, then that's not community spread. Community spread is where it's in the air and you don't know where it's coming from. My epidemiologist kind of cuffed my ears for using that term yesterday, because it's a very specific term. But the person got it in the community from somebody, probably from somebody that had visited that patient.
Is there any reason to worry about a gym or a public place like that where people are sweating, things like that?
I think there's always reason to avoid situations that put you at risk for any number of diseases. I think people should wipe down, in a gym, for example, I think people should wipe down the machinery that they use, and because there's lots of other things out there other than coronavirus. Matter of fact, there's a lot more things out there than coronavirus.
Okay, all right.
Okay, well, thank you very much. It's great to see you guys. And again, Monday, Wednesday, Friday, same time. Thank you. Did I go? Did my pace work for you? You're a future habit. You always stand the same time.
Someone called Sunday morning, like they got diagnosed with coronavirus, but wasn't the severe one. Is that possible?
Oh, yes.
That's possible, okay.
Yeah, there's a common one that just causes cold.
So there's no, it's not as